One, in terms of the origins of the virus, our best advice remains that it came from zoonotic or animal sources, but this is precisely why we argued for an impartial and independent and comprehensive international evaluation, and why I think the result at the World Health Assembly last week, a unanimous decision, co-sponsored by 137 countries, Australia and the EU working together, was so important. And now we will have our disease detectives with the capacity to be real disease detectives. But we know it eventuated in Wuhan. We know the first case was first detected case was within the wet market. As to the precise origins of transfer, well, that's for the disease detectives, but our overwhelming advice is that it likely came from animals to humans.
4 to 6 week human trials that he's claiming he will have started?
Well, there are many vaccine candidates. We hope any and all of them work. As to which ones do, that will be a matter for medical science. My job and our job is to make sure that there is support for it, that it's done in a safe way, which adheres to the highest medical standards, and that if a vaccine candidate is successful, we have the capacity to produce in Australia. And I have spoken with directly CSL now at the chief scientist and at the global head level, and they are ready to produce in Australia if there's an Australian candidate, or ready to produce under licence for a global candidate if it's someone from outside of Australia. So if it is successful, we'll be one of the first. Claire?
Since you spoke at the World Health Assembly last week, there's obviously been some commentary from China about what the agreed-to inquiry would look like versus what yourself and the Morrison government had pitched. What is the next stage for getting that inquiry to look more like what Australia wanted? And given that China put that caveat of when the pandemic is under control as to when it might ever start, and that we're seeing in Latin America, South Asia, as you mentioned, bigger outbreaks. Are you concerned that they could kick that issue significantly down the road because the outbreak is likely to keep expanding in those other countries? No, I think what came out of the World Health Assembly was an immensely important road forward for the world, and it was an immensely important step. The what's called the Independent Oversight Advisory Committee is, at this point, I understand, taking the lead. Australian officials are now working, both from DFAT and Health, through the World Health Organization in Geneva, and I'm very confident that that process will begin to take form. We've got that motion. Many thought that it was an impossibility that we would have a motion pass calling for an independent and comprehensive evaluation. It didn't just pass, it passed unanimously. It passed with 137 co-sponsors. It passed with a partnership between the EU and Australia and many, many others. Very strong support from Africa, which was extremely heartening. So there's momentum, and we will continue to work constructively. I'll take one very last and then we must go.
Thank you so much. Just on the statement about, originating in Wuhan, there was a case in France that they back-tested pneumonia samples and found a positive coronavirus case back in December, 27. And it's not really known how that happened or that kind of happened at the same time as the Wuhan outbreak. Do you have any advice about that? Do you know how that happened? Have there been any discussions about what that means about the outbreak of this virus?
No, I don't have any details on that. What that emphasises, though, is the importance of a comprehensive investigation. The more we know about the earliest origins, the more we are able to trace back to the likely source, the overwhelming belief that it has an animal or zoonotic origin, but a full investigation is not just in the interests of this pandemic, it's in the interest of helping to prevent and to protect against a future pandemic, but ultimately, at a time when we're nearly at 5.5 million people who are infected, over 340,000 lives lost. We're clearly heading to more than 6 million people to have infections. It is about honouring the legacy of all of those who have been infected, all of those whose lives have been turned upside down by the health and the economic impacts, and all of those who have sadly been lost. That's why we need, that's why we have, and that's why we will deliver a comprehensive investigation. Thank you very much.